I'd first like to welcome everybody to today's webinar today's COVID-ended webinar on evidence synthesis communities in low-income and middle-income countries and the COVID-19 response. Before I pass it over to Lawrence for a quick introduction, I'd just like to welcome our two speakers today. We have Ms. Amena El-Harakeh, is a public health researcher currently based in the U.S. She received her master's in public health with a concentration in health management and policy in 2017 from the American University of Beirut. Amena worked as a research assistant at the Center for Systematic Reviews on Health Policy and Systems Research for 3 years. Her main interests focus on health systems and policy research, priority setting, and evidence synthesis. Joining her is Dr. Bey-Marrié Schmidt, who's a senior lecturer at the University of the Western Cape. She is training in anthropology and epidemiology. Her expertise are in conducting qualitative evidence syntheses and systematic reviews of public health and health systems interventions and knowledge translation methods that can bridge research evidence into health policy and practice. So now I'd like to pass it over to Lawrence from the Africa Center of Evidence, and he'll provide a quick introduction to COVID-end before passing it off to Amena and Bey for their presentations.
Super. Thank you so much for that, Stephen, and a warm afternoon here from Johannesburg, and good morning and good evening to the other sides of the globe. It's really lovely to be here, and I'm looking forward to the talk very much. I think we have two fantastic speakers on an amazing paper, so those of you who had a chance to see the paper already, I think we are in tune for a really exciting afternoon, and my job really is to give you a very quick introduction to COVID-end itself. So I'm spending between you and the main act, and I promise to be very brief. So I hope the slide moved on. So just very quickly, what is COVID-end? COVID-end is a time-limited network. So we came together as a body of organizations to respond to the COVID-19 pandemic, and in a sense it gives us the particular purpose, and it also gives us a very clear cutoff point for how long we are going to be in existing at a network. And I think we really at the broadest, we look at two particular types of audiences. So the first one, trying to support those who are supporting decision makers, and then the second one, the researchers who are trying to produce the evidence that is needed to address the pandemic. And I think at the broadest level, you could differentiate that in the demand side of evidence and the supply side. And we are really a group, I think, of more than 50 organizations. It covers a really broad area from evidence synthesis to technology assessment and to guideline groups. And it is diverse in its spectrum, what it's trying to cover. So we look at different ways of responding to the pandemic, from public health to clinical management, different groups from different countries. So I'm from South Africa, and then we have quite a diversity within that. So the next slide is just a really quick overview of some of the partners. I think some of these organizations might look familiar to you. And it is really a nice and lovely and vibrant group of colleagues coming together. And so my apologies, I have a bit of a delay on my side. So if you want to know more about us as a network, we have a website that has the main information on the organization itself. I think a few points to highlight really there is the inventory of the best available evidence syntheses. A package of horizon scans, so what are emerging issues that are coming up, and in particular the community of those different groups who come to this endeavor of responding to COVID-19 rapidly. And that is where I think the sustaining engagement group particularly has a role, and we have a list of over 250 members that you can join on the link below, and we also do these webinars. So it's quite exciting to have the next iteration of these, and you can reach us on email and on Twitter as well. And then lastly, quickly, just to acknowledge the funding for COVID-end. So many thanks to the Government of Ontario, the National Institute of Health Research, a couple of individual donors, as well as the Canadian Institute of Health Research. And with this, I hand over to the main act, our two lovely presenters, and apologies again for the slight technical issue on my side.
Thank you so much, Lorenz and Stephen, for the introduction. Hello, everyone, and welcome to today's webinar on the response of evidence synthesis communities in low and middle income countries. So today we'll be looking at the following. Can we? So Stephen, can you help us with the next stack of slides?
So you should be able to advance it. Is it not showing the correct presentation, Amena?
It is still showing Lorenz's presentation. Okay, it works now. Thank you. Yeah. So in today's webinar, we will be looking at the following. First, we will be going over some of the conceptual and practical challenges that the pandemic poses to evidence synthesis organizations in LMICs, and also to introduce some of the strengths and the contributions of these evidence synthesis organizations that are based in low-middle income countries during the response to the pandemic. And it's important to note that this is based on a collective learning experience for the COVID and partners and members that are from low-middle income countries. It was an email discussion between the partners and information sharing among the members. And we're really excited to share this with you today. So just again, as Lawrence mentioned very briefly, COVID-End is a time-limited network that the evidence synthesis and guideline community have convened in response to the pandemic. And the goal is really to help support decision makers to find and use the best available evidence, but also to support researchers in reducing duplication of research and better coordinating between the evidence synthesis groups. There are more than 50 partners in COVID-End, and the low-middle income organizations are represented among those partners. So what I'm going to share today is based on the feedback and the information sharing of more than 30 partners and members from the low-middle income countries in COVID-End. So why are we focusing today on this particular group? So the low-middle income country evidence communities, those are groups and organizations that are well placed to support evidence-informed decision-making in their context. They include established and locally driven centers that are part of technical and that can be part of technical and regional networks, and they are sometimes well supported, not in all times. Sometimes they are well supported and they are trusted by decision makers to provide the best available evidence. And during the pandemic, those groups mobilized. They were mobilized to respond to urgent requests from decision makers, as well as synthesize the best available evidence, as I said. And in most of the instances, we see that the request is to conduct rapid reviews and not regular reviews due to the urgency of the situation, and to deliver that in a short time frame. Some were requested to maintain the reviews in a living mode in order to integrate the rapidly growing evidence base. And in other instances, many of these groups collaborated amongst each other, but also collaborated with internationally, so with groups from high-income countries. So why are we saying that? Because these achievements are often despite and not because of the circumstances in which these groups work. So what are some of the challenges? Many of us work in countries where there are complex challenges, including a weak health system that is generally struggling to make the necessary responses to the pandemic, as well as the prevalence of comorbidities and other challenges. In addition to the pre-existing and rapidly worsening vulnerabilities due to inequalities, inequities, unemployment, hunger, and malnutrition. There's also violence against women and children, unintended pregnancies, and other escalating problems that are in parallel to the challenge of responding to the pandemic. We're also observing fear and stigma associated with COVID-19, quarantine, and isolation. And this is besides of the mental health problems, pre-existing ones. Besides, all people, older people as well as migrant workers, refugees, and students have all found themselves vulnerable and inadequately supported. And finally, it's important to highlight that in many countries, these challenges have come on top of, as I said, entrenched economic, social, and political pressures, and thus present considerable demands on researchers seeking to generate evidence in the COVID-19 response. So the demand for evidence to inform decision-making and for effective implementation of such policies, these typically outweigh the abilities of these groups to respond. And this situation is compounded by an increased demand for transparency amid all the mistrust about science that some groups, for example, politicians in certain countries, bring to the public discourse. So those were the higher level or the conceptual challenges. But on top of that, there are practical challenges while delivering the evidence to decision makers. And there's a broad community of evidence synthesis specialists based in low-middle income countries. Many of us are experiencing common difficulties, such as the technical ones, including limited access to computer hardware and software, restrictions on database access, limited data storage capacity, inadequate data coverage, low internet bandwidth. But I'd like to highlight here that some groups or some organizations were fortunate enough to benefit from their international collaboration to try and minimize these difficulties and provide the best available evidence. So some staff members were also working under difficult conditions, and some were working even without salaries or with the fear of losing their jobs, so there was job insecurity. So as I said, other than that, there are the work based on the use of personal computers, living in unfavorable conditions, and working under pressure. So these were not seen before because of the remote working experience, but because of working in institutions. But with the remote working experience, these were heightened and presented to the world. Some groups also highlighted the issue of limited number of experienced staff members. So, besides the regular work that the staff have to do, they need to respond to the pandemic, and there is limited capacity in that sense. In addition to the constrained funds that have to be repurposed from other groups to enable the increased efforts to generate timely and locally relevant evidence synthesis. And this work, so after we shared our experiences and realized that there are common themes in terms of the challenges that these groups face conceptually and practically, we synthesized this in a Lancet commentary in which we highlight these challenges and realized that despite these challenges, our network continues to generate evidence and support decision makers. And there are strengths that enable this response. So they now will walk us through the contributions of the low-middle income, some of the contributions of the low-middle income country groups, as well as their strengths and enablers for this response. Bey.
Thank you, Amena. So Amena has highlighted the conceptual and practical challenges that we were experiencing and some that we still continue to experience as low middle income country evidence synthesis organizations. And so after sort of looking back after the Lancet commentary was published, we sort of started to see that we're actually making a contribution and impact locally, and that there are certain strengths that our organizations have that have enabled us to continue with the response and to make an impact. So I'll be briefly introducing the different types of contributions and the strengths, and very broadly speaking from the perspective of the low middle income countries that are part of COVID-19. So we've been sharing our experiences and sharing learnings through email and listserv discussions, and that's really what I'm presenting here. And also just want to acknowledge Michael McCall from Stellenbosch University, who helped me to compile this list of contributions and strengths that I'll be sharing with you. And also just to note that although at the end we acknowledge the different LMIC evidence synthesis organizations, there are partners from various countries that we want to acknowledge now and that we'll also acknowledge at the end of the presentation. So when we talk about the contributions, these are really just a list of examples of the different types of contributions. And one of them, as Amena has mentioned, has been that there's been a strong focus from our organizations to produce rapid reviews, which are to inform national guidelines and protocols. And also in that capacity, we've been supporting guideline development, so really promoting tools and frameworks, for example, like the Grade Evidence Decision Make Framework, to systematically and transparently enable decision makers to actually develop the guidelines and to provide protocols. There's also been an opportunity for us to build capacity about evidence-based healthcare principles in general, and this has been in our engagement with different decision makers, really bringing to life the ability to use evidence, to find evidence quickly, to use it, and how that can quickly make a decision and an impact at the local context. We've also been producing, alongside evidence production, different knowledge translation products like technical briefs, policy briefs, also summarizing some of the rapid reviews that have been done through Cochrane into Cochrane Corners, which are summaries that have been published in local journals. And then, of course, also considering in our evidence production different types of review questions, so both qualitative and quantitative review questions. And then individual members have also been contributing to COVID-19 national, regional, and international advisory committees and different evidence synthesis initiatives. And that's also been a really good opportunity to advance collaboration. And then, of course, social media and using mainstream media to promote the dissemination of evidence. So in terms of some examples of the strengths, so collaboration is really one of the big strengths, and in many ways evidenced through COVID-19. And also in terms of just our continuous engagement as LMIC organizations, there's just also another good way of showcasing this collaboration. And collaboration has been between people and organizations who work in different disciplines and also from different countries. And this has enabled access to a wide range of tools and resources and services that we can offer to each other or that we can use from each other. And then also people have shared, so we've also been sharing about how we've been able to work in ways that are maybe not as before, where we have more regular meetings than before, where people are really willing to have meetings and communicate more regularly. And this is with teams and collaborators, and this is for the effective planning of tasks, timelines, and resources. And also they're considering that people are working across different time zones. So just being able to advance this idea that we're producing evidence around the clock. Yeah. And then, of course, people tapping into existing networks. So most of the LMIC evidence synthesis organizations are based in different types of institutions, so government, research institutions, and universities. And that means that people are able to then tap into different types of resources based on how they are positioned. And then Amena touched on this a little bit about having to reorganize personal capacity, sometimes reorganizing people working on other projects, and also hiring and training postgraduate students and other types of volunteers in evidence synthesis in order to quickly produce evidence. Then continuing on with more examples of the types of strengths that have enabled LMIC organizations to respond rapidly to the COVID-19 pandemic. One, of course, is that our organizations are strong at evidence synthesis, that's sort of the core business, but also that we have extensive experience in knowledge translation. And this means that people are able to multitask, not only produce the evidence, but also disseminate it, but also serve on different committees. So people are really playing different roles. And then I think this is something that may not only be applicable to LMICs, but just the general sense that people are more motivated to make a difference. And generally, there's also been supportive leadership amongst the organization. And as I mentioned before, I think the need for regular communication also resulted in sort of fast communication tools being utilized, like WhatsApp or other types of group chats, which of course allows for easy and rapid communication, open discussions, and even being able to quickly communicate any changes to tasks or to timelines, etc. And then a few organizations from LMIC settings mentioned that they have communication officers who help push out their information. So that also makes a huge difference in terms of being able to disseminate evidence via social media, websites, and newsletters. So these are just, some examples of the discussions that we've been having about how we think we've contributed to the COVID-19 pandemic in terms of the evidence demand and what things have enabled that. And so from these discussions, we've seen that there's actually a potential for LMIC partners to more formally collect and report on these shared experiences. And so we want to apply for ethics approval so that we can validate some of the informal discussions that we've been having by email and through our listservs, and to also put the correct ethical measures in place to be able to collect this data and analyze it and write it up as to a broader audience. And we hope that by sharing our experiences and how we responded to the demands of the COVID-19 pandemic, we will be able to strengthen the voices of LMIC evidence synthesis organizations on a global scale. Lauren presented this slide previously, but we also just wanted to make you aware of the website, the email address, and the Twitter page for COVID-End. And then we'd also just like to acknowledge all the LMIC members of COVID-End who contributed to the Lancet commentary, but also contributed in the discussions and who enabled us to be able to share some of our experiences here today. Thank you. We'd welcome any comments or questions, and if there are any participants from low middle income countries who maybe are not necessarily part of COVID-End, who would like to also share their experiences, would welcome those.
Thanks very much, Bey-Marrié and Amena, for a great presentation. That was very, very insightful. as you mentioned, we encourage people to ask questions or share comments. If you would like to do so, please use the chat box on the side of the screen. While we're waiting for any questions or comments to come through, I might just pass it back to Lawrence to see if he has any questions or anything to follow up on from this presentation.
Sure, thank you. So while I was thinking through this amazing presentation, thanks so much for really putting a spotlight on the key issues. So I wonder if you reflect back, and I mean, I know the pandemic is not over at all, but in your experience, would you say that the pandemic has increased the profile and the ability of evidence synthesis organization in LMICs, or has it undermined growth? I think would be interesting to hear your thoughts on to what extent have we leveraged this, and evidence has certainly been demanded, but as organizations, were we actually able to make the most of that, and where are we going in the future? And then maybe, because I know I'm throwing you a little bit into the deep water, so maybe while you have a think, just to, I think, share a personal anecdote of being, we're being based in South Africa, and I think some of these challenges that often they can sound very abstract, but for my wife and myself, we spent most of the pandemic with all our family members coming to one house because it was the easiest to handle centralized logistics. So we ended up kind of being 11 of us in a 3-bedroom house. We had one Wi-Fi router that only had a single provider in the area. All of the teenagers suddenly had to school online. The schools had never had to do that. The teenagers these three never had to use a computer for work or professional education at all. So that is kind of how we try to keep my wife and myself, how we try to keep our professional lives going in this context here in Johannesburg. And so I think it gives a bit of a feel for, if we talk about these challenges, we say that internet access, the social and professional infrastructure not being up for the job really. I hope it gives a bit of an example of what that means for an experience. And personally, I couldn't agree more with this point of how collaboration has helped us pull through the organizations that we kind of had known before, but never really engaged fully with. All of a sudden, colleagues came together on a shared issue, and if I couldn't be online, I knew somebody else, not necessarily even from my own organization, would step up and fill that role. So I think through that experience, the kind of solidarity and collaboration was amazing, at least in our context here. And back to you. Maybe any thoughts on my initial starting question?
Amena, do you mind if I go first? In terms of, I think, the increase in the profile for evidence synthesis locally, so my work has been, in terms of the COVID-19 pandemic response, has been through the South African Medical Research Council. And I think although we already had existing relationships with the Ministry of Health, I think the response has been a really good way of showcasing a real problem right now that needs a solution right now, and also the aspect of limited evidence and different countries across the world responding differently. So really having to for decision makers having to rely in a way on evidence synthesis producers, and so I think it has increased the profile. It has definitely shown the impact of what we sort of have been advocating for, with maybe problems that were not perceived to be that urgent in that moment. And also just, I think, demonstrating that researchers can respond very quickly and can respond to issues that are priority right now, which I think are some of the perceptions that exist out there about people who produce evidence, like researchers. And then I think in terms of sort of the question about the personal experience, so for me, I've been a researcher who's been contract funded, and I think one of my real sort of challenges was around competing work interests. So having a project that is funded by a funder that, of course, isn't funding COVID-19 research, and sort of having to work around that with them, and the response that is more urgent around sort of time, and actually having a funder. I mean, I think we had a positive experience where our funder was really understanding and also was happy for us to allocate some of my time to the response activities. So I think that's been sort of a positive experience, but of course having the challenge of existing projects that still need to be delivered, and also responding to the pandemic. And I think that's maybe a global challenge, not necessarily an LMIC one. So yeah, over to you, Amena.
Thanks, Bey. If I may add, in terms of increasing the profile from our own experience in Lebanon, I think that there were a lot of created opportunities for our groups and our staff, mainly on an international level. Because, for example, in Lebanon, we had a very difficult. This is a very minor example, but it shows how the opportunities were created. So we had a very difficult economic situation that is still existing, particularly the devaluation of the local currency. So being able to work on international projects allowed our efforts as staff to be compensated in US dollars, which served a much needed financial support. And this is indirectly gives motivation to staff to work even harder. But also there were some other opportunities. For example, we used a software that was freely accessible to us that we did not use from before due to this international collaboration. Some journals waived their open access fees because of the situation in Lebanon. So this was concurrent with the pandemic, but not because of it. So I would say there was more visibility for the staff and the group that were working in low middle income countries, but also more visibility for the evidence synthesis community and its important role in supporting decision making.
Great, thanks Amena and Bey. We have a question from the chat. Nadia says, thanks for the presentation. And then her question is whether there's any data or experiences that you could share of LMICs in Southeast Asia, as right now it seems like that the LMIC members of COVID-19 are based more so in Africa and South America.
So I could comment on that. It's mainly based on in the Middle East, so Lebanon, our experience, Africa and South America. We're hoping that through the continuous work that we're doing in terms of email discussion and also the discussions on listserv, which is open to all countries, all groups and all countries, to get more representation of LMIC. So till now we don't have that, but thanks for highlighting this. Maybe we need to focus on a more broader presentation. Bey, do you like to add anything to that?
I don't really have anything else to add. I think it's just a good point to note in terms of which organizations right now are represented from which parts of LMICs. And so I think it's worth noting because, I mean, we want to have this as representative as possible. And also, I think a note for maybe COVID and maybe for you, Lawrence, in terms of being able to engage other organizations in different parts of LMIC settings.
Great, thanks. And I know that the number of partners for COVID-19 has continued to grow, so hopefully there will be more groups from that area that do join the COVID-19 network for sure. I just had a quick question that obviously this is, this whole initiative is primarily focused around COVID-19 and the response to that, but looking forward and kind of building off what Lawrence was mentioning earlier, how do you see some of these kind of key lessons learned and key principles from this COVID-19 network translating into kind of future networks and future opportunities to, better spread and better make use of the evidence-informed decision-making across LMICs?
I have some thoughts on that too, but maybe I'll leave Bey and Amena first to offer, but I'd like to comment on that one as well, if it's okay.
So, I just had two thoughts. I haven't thought about this thoroughly, but one is the aspect around how we promote evidence synthesis and how we promote evidence-informed decision-making in general. And I think what this has allowed for, just reflecting back on the contributions that we've been able to make and the strengths that have enabled those, is actually that there's a case study here. There's a real story to tell about the usefulness of using evidence to inform guidelines, to inform changes to practice. So something that is more tangible to take to different types of decision makers when we promote our other work, even if it's, for example, promoting work in TB or HIV, just being able to actually show how our response for the pandemic has actually had an impact and how it has enabled evidence-informed decision making. And then I think there are some, I guess, more practical, but also we need to obviously consider aspects of feasibility and funding lessons. And for me, those are around the rapid generation of evidence. We've been able to do it, of course, in the ways that we've been able to do it. Not everything has been completely sustainable. And I think that even now, sort of that quick response has sort of died down a little bit, just because it's not sustainable for a very long time. But just drawing out which aspects we can actually adopt for the long term. So I think even in terms of the methodological work, being able to just learn and share from each other, and templates that we may have generated for the different types of sort of dissemination tools and so on, just being able to share those as well in terms of and adapt them to our other work.
Yeah, and I agree with Bey. So COVID-19 represented an opportunity to these groups to be further strengthened, but also to institutionalize the evidence-informed policymaking across low middle-income countries. So there is increased trust in the work of these groups and recognition of the importance of the work. And as Bey mentioned, the importance of timely delivery. So the decision makers now, they set the standards high for rapid responses to their requests. So this is a challenge, but also an opportunity for groups to respond to it.
Yeah, I think you've probably covered absolutely the key points. That the only thought that I would add, to me, it's almost a bit like this was a proof of concept. As much as it's a time-limited network, it does pose a question: why, as organizations, haven't we come together before to collaborate at this scale and this rapidness? So, if like basically, why didn't we have COVID end? Why did it take COVID to establish a network such as COVID end? And I think that's something that we're reflecting on quite a bit at the moment. What does it mean for evidence networks? And the power of this collaboration certainly is applicable to other areas, not just COVID. And I do think it has shown that as a concept, such a network is feasible, it adds massive value. And why haven't we done it before? And what happens after COVID? Maybe we wouldn't need a COVID-specific one, but the institution itself, as a mechanism of collaborating, to me, there's a long-term implication. If that's not something that, as the evidence synthesis community, is something we should invest in continuously to be prepared for the next pandemic or the next crisis.
Lawrence, if I may add, so from my work with COVID, and this is very true, and there is a lot of focus on the long-term impact of this network in terms of increasing collaboration and reducing duplication of efforts on a global scale. And from this work on the voices of the LMICs, so how to sustain, we're trying to see how to sustain the voices of LMIC researchers on a global scale, as you said, beyond COVID-19.
Great. Thanks, everybody. I don't see any other questions in the chat box, so I'd just like to take this opportunity to, again, thank Amena and Bey for joining us today for a really interesting discussion and sharing some great insights from their part. The recording from today's webinar will be made available on the COVID-End site, as will information about future COVID-End webinars. Oh, I see we do have one other question, so before we go, we'll just address that. So from John, he says, thanks for the superb presentation and the Lancet paper on which it was based. So his question is whether our colleagues in LMICs have found it as challenging as we have to build connections between our evidence synthesis community and the community of people involved in data analytics and modeling. If you have had positive experiences in building these bridges, it would be great to hear about them.
I can just share from our our experience at the South African Medical Research Council. So we have a forum that was established mainly for UHC, so Universal Health Coverage Implementation. So that forum existed before the COVID-19 pandemic, and there already we were, as systematic reviewers, trying to sort of share information and establish collaborations with data analytics and data modeling people. And this was mainly sort of people modeling sort of long-term surveillance data. So that platform was already there. And so I think when the pandemic hit, we've tried to sort of share, but I think it's a sharing community. So basically just sharing the findings that we've seen from the rapid reviews that we've produced, the inputs that we've given in terms of national guidelines and protocols and so on, and them sharing sort of the surveillance data around COVID-19 deaths. So we haven't worked with them closely, but I think because of that forum, there's been a lot more engagement and a common, I guess, question around COVID-19. So that's the only experience that we've had from my side.
Yeah, so unfortunately, I'm not aware of any collaboration with data analytics and modeling, but this is not representative of the experience of Lebanon or the centers in Lebanon.
Okay, great. Thanks again for your insights and answering all these great questions. Again, the recording from this webinar will be made available on the COVID-End site, as will information about future COVID-End webinars. So I think with that, we'll wrap up today's webinar and hope that everybody will join us again for future COVID-End webinars. So thanks again to Bey, Amena, and Lawrence for joining us today.